Good morning, everyone. I'm Dr. Cara Christ, the Director of the Arizona Department of Health Services. Thank you for being here as we get ready to launch this COVID-19 vaccination site as a state-run operation in partnership with Maricopa Community College and many others. Since December, Dignity Health and Maricopa County Public Health have made this site essential to the East Valley. When the time came to discuss next steps, it was an easy decision to transition this to a state-run site. Along with State Farm Stadium and Phoenix Municipal Stadium, continuing a Chandler-Gilbert Community College site helps position the Phoenix area to get as much vaccine into the community as possible when federal supplies increase. I'm pleased to be joined by the Chancellor of Maricopa Community Colleges, Dr. Stephen Gonzalez, and by Dr. Greg Peterson, President of Chandler-Gilbert Community College. We really appreciate your support in continuing this operation so that we can continue serving the East Valley. This partnership with Maricopa Community Colleges goes beyond simply having access to this space. Under the direction of the faculty here, nursing students have been and will continue volunteering as clinical workers. They are gaining important clinical hours by vaccinating along with other clinical staff. As with other state-run sites, our volunteers are absolutely essential. We're joined today by Dr. Christine Wiggs, Director of Community and Health Advancement for Blue Cross Blue Shield of Arizona. As with State Farm Stadium, which has been a 24/7 operation since January 11th, Blue Cross Blue Shield of Arizona is providing volunteers to check people in, direct traffic, and perform other tasks needed to vaccinate hundreds of people an hour. So thank you for your help and your support, Christine. I'm also joined by Major General Michael McGuire, Arizona's Adjutant General and the Director of the Arizona Department of Military Affairs. DEMA's logistical know-how has helped each state-run site become a national model for mass vaccination, drawing attention even from the President and Vice President. So thank you for your agency's assistance. Oh, he's over here. So thank you. They have been essential in getting this vaccination site and all others stood up and operational. The state sites at State Farm Stadium, Phoenix Municipal Stadium, and now Chandler-Gilbert Community College have helped greatly increase the administration of COVID-19 vaccine in Arizona. These sites have been built off the best practices of the existing vaccination sites run by Dignity Health, Honor Health, Tucson Medical Center, Banner Health, Abrazo, and other facilities around the state. They complement the efforts by Maricopa and Pima County Health Departments to get vaccines, including the recently approved Janssen vaccine, further into communities and to our essential workers. This site already has a proven record of success, but the partnership will allow for expanded capacity and hours of operation when the vaccine supply can support it. Eventually, it can become a 24/7 operation that can serve up to 6,000 people per day. To date, 1.9 million doses of COVID-19 vaccine have been administered to 1.2 million Arizonans, including over 645,000 who have received both doses and are fully vaccinated. So when your place in line arrives, I urge you to get vaccinated. These vaccines are the light at the end of the tunnel, and they are one of the most effective public health tools for controlling infectious diseases, whether that's influenza, measles, or whooping cough. I'm now going to invite Major General McGuire to say a few words.
Good morning, everybody. Thank you, Dr. Christ. Thank you, Dr. Gonzalez, and all of Maricopa Community Colleges and their campuses, specifically here at Chandler-Gilbert, a campus that we've been utilizing since the beginning when we started with the 1A pods. These transitions, as the one that you saw just about a week and a half ago at University of Arizona, were anticipated as we got through 1A and we needed to get healthcare workers back to work. Could we find volunteers to keep the sites up and running? Because as we look at the math going forward, we realize we're going to need mass drive-through sites to meet our objective of midsummer getting 3.5 million Arizonans over the age of 18 vaccinated. So this site will continue to help us sustain that. To the group that was running it previously, Dignity Health, you were the incident command team. You did a great job. Thank you so much for getting all of the community members over 65, as well as all the healthcare workers through here quickly and rapidly. We thank the partners at Walgreens, as well as Blue Cross Blue Shield, that are going to come in and work at this same campus to continue that effort. I also want to emphasize one thing for the media and for our partners out there in the community. This was the site that we stood up this volunteer vaccine brigade. I want to thank Dr. Brian Young, who is a retired National Guardsman, who asked if he was a doctor, if he could bring some people out, and that thing has grown week over week, and this was the site that we were utilizing them. They will continue to be here at this site, providing vaccines, a mass drive-through, and again, you'll see a few of the Guardsmen dressed like me, helping triage and get us through this initial transition phase, and then moving out to Yuma for our ground-up startup as our next endeavor. So again, thank you very much to all of our community partners. Thank you for Dr. Christ for her guidance on policy and leadership on where we need to go. And then once we're given direction, we'll just move in and continue to move these mass sites as they are our highest volume push. And I was told today by the team we're going to hit 2 million total vaccines by the end of the week, primarily due to the drive-through sites. So we really appreciate all the effort of all the people working. And I know how critical those pharmacists are to draw in those vaccines. And I want to just say thanks to them for all they do. Thank you.
All right, and so now we'd like to have a few words from Dr. Gonzalez, the Chancellor of Maricopa Community Colleges.
Good morning, and thank you, Dr. Chris. On behalf of Maricopa Community Colleges, I want to say thank you to the Arizona Department of Health Services and to the Governor's Office for selecting this site as its latest pod for vaccination. Like many other organizations across the state and across the country, we have been severely impacted by the COVID-19 pandemic, and having more access to the vaccines will allow our organization to get back up to speed as quickly as possible. So we are honored to serve the community. We have served the community through this pandemic by ensuring that many of our college campuses had access to testing sites, and to have one more vaccination site is an honor to do. We are also looking at opportunities to have our other college campuses serve as pod sites around the county, so more to come there. The more that our employees, our staff, our faculty, and students can get vaccinated, along with the public, will get us back to a sense of normalcy as quickly as possible. Dr. Chris, thank you very much. We look forward to this continued partnership. Thank you.
All right, and now we'd like to hear from Dr. Peterson, the college president for Chandler-Gilbert Community College.
Good morning. Welcome to Chandler-Gilbert Community College. We're so glad that you're here. We are so honored to continue to be a site. We have been here, as you know, I feel like we have wrapped ourselves around the community as we've approached COVID. So on the other side of campus, we have a COVID testing site. We have our vaccination site on this side. To date, coming in, we have already administered 155,000 vaccines at this site. So we're excited to be able to continue to do this amazing work with our partnership now with the state and our other partners. As Dr. Chris mentioned, one of the most amazing things that we've seen is the ability to engage our students in their learning by having our nursing students. We've had over 100 nursing students participate in helping administer the vaccine, calm patients, explain the process, and really be able to understand what it's like to support our communities in these types of circumstances. We're excited for the opportunity to continue to do that work for our students. We're so glad that you're here. I would do a howl, as were the coyotes, but it's a little early. So instead, I'll just say welcome, welcome. And with that, I'd like to introduce Dr. Christine Wiggs, Blue Cross Blue Shield Director of Community Health Advancement.
Good morning. On behalf of Blue Cross Blue Shield of Arizona, we are honored to be part of this collaborative effort. There's no place we'd rather be than right here helping Arizonans get vaccinated. Being part of this next state-operated vaccine site allows us the opportunity to ensure more Arizonans can take one step closer to doing life the way they used to enjoy prior to the pandemic. At the heart of the vaccination site are the volunteers who dedicate long hours to ensure everything runs smoothly, and this means that more Arizonans get vaccinated every single day. But even more impactful is the experience that volunteers contribute to people coming through the vaccination experience. They welcome patients, they provide comfort and reassurance if needed, and they celebrate every single dose of the vaccine that's administered every single time. Volunteers often share they are forever changed by this experience of helping their community get re-inspired with a dose of both hope and good health. Blue Cross Blue Shield of Arizona, along with our employees, family members, friends, and community members, have provided more than 110,000 volunteer hours to support State Farm Stadium, and we look forward to providing that same level of support here to ensure the Chandler-Gilbert Community College site is successful as well. Thank you.
And now I'd like to introduce Maria Cristina Fuentes, who is the Director of the Governor's Office of Youth, Faith, and Family.
Thank you, Dr. Christ. Muy buenos días. Mi nombre es María Cristina Fuentes y soy la directora de la Oficina del Gobernador para Juventud, Fe y Familia. Gracias por estar aquí con nosotros mientras nos preparamos para lanzar este centro de vacunación de COVID. Este centro estatal, en asociación con el Maricopa Community Colleges y muchos otros enlaces que ayudan que esto sea posible. Desde diciembre, Dignity Health y el Departamento de Salud Pública del Condado de Maricopa han hecho que este centro sea esencial para la comunidad. Y cuando llegó el momento de discutir los próximos pasos, fue una decisión muy fácil para la transición a un centro administrado por el Estado. Junto con el State Farm Stadium y el Estadio Municipal de Phoenix, la continuidad de este centro en Chandler-Gilbert Community College ayuda a posicionar el área de Phoenix para obtener la mayor cantidad de vacunas posible en la comunidad, cuando las dosis del gobierno federal aumenten para el estado de Arizona. Los centros estatales en State Farm y en Phoenix Municipal Stadium y ahora en Chandler-Gilbert Community College han aumentado a gran medida la administración de la vacuna de COVID en Arizona. Al día de hoy se han administrado 1.9 millones de dosis de vacunas a más de 1.2 millones de arizonenses, incluyendo más de 650,000 personas que ya tienen ambas dosis. Cuando llegue su turno, les exhorto que por favor se vacunen. Estas vacunas son la luz al final del túnel. Las vacunas son una de las herramientas de salud públicas más eficaces para combatir enfermedades como COVID. Recientemente, nuestro estado ha visto una disminución de los casos de COVID-19, ya que los arizonenses han seguido las estrategias de mitigación, estrategias requeridas para reducir la propagación de esta enfermedad. Les agradezco a todos por ese esfuerzo y por favor sigan haciéndolo. Queda todavía un largo camino para recorrer en nuestra batalla contra el COVID-19, dado que pasarán varios meses antes de que la vacuna esté disponible para todos. Debemos seguir haciendo todo lo posible para mitigar la propagación del COVID-19. Tenemos que seguir tomando precauciones cada vez que estemos cerca de personas que no sean miembros de nuestros hogares. Por favor, continúen usando una mascarilla de tela sobre la nariz y la boca. Mantengan una distancia física de 6 pies. Lávense y desinféctense las manos a menudo. Quédense en casa si se sienten enfermos y eviten las multitudes. Gracias a todos los que han hecho este centro posible. Muchísimas gracias.
Thank you, Maria. So I think one of the most important takeaways is that our volunteers really are essential and they are the lifeblood of our vaccination sites. Without them, we would not be able to do it. And they are also one of the most positive pieces of feedback that we get is that the volunteers were happy, they made people feel comforted. And so we really, really thank all of the volunteer organizations that are helping us run these state pods. Lately, our state has seen a decline in the COVID-19 cases as Arizonans have followed the mitigation strategies that have been required to reduce the spread. I thank everyone for that, and we need to urge everyone to keep it up for just a little bit longer. There's still a ways to go in our battle against COVID-19. Because it will still be a couple of months before a vaccine is available to everybody who wants it, we must continue doing all that we can to mitigate the spread. So those precautions still need to happen when you are around people that you do not live with. You want to wear a mask over your nose and mouth, Maintain at least 6 feet of physical distance. Wash your hands and use hand sanitizer often. Stay home if you are sick and avoid crowds. So we want to thank everyone again for who has made this partnership a reality for the people of the East Valley and all of Arizona. And with that, we would be happy to take any questions, and then our participants and volunteers will be available for one-on-one interviews. All right, Steve.
Hi, Dr. Chris. Hi, I've got a number of questions for you, but my first question surrounds those with disabilities. I've heard from a lot of adults who suffer from disabilities, but also have underlying health conditions along with those disabilities. Many of those haven't been able to leave their house other than for doctor's appointments. When we changed to the new phase, the age-based phasing, a lot of those were under the age of 55 when they were hoping to be that next group. What can you tell us about the prioritization of those with disabilities?
So for those with chronic medical conditions that would have been prioritized in the 1C category, this will actually move those individuals up. When we go to the age-based category, we anticipate that it'll be about 4 to 5 weeks as we transition through the age categories. So they will be eligible earlier, because otherwise we would have had essential workers as the remainder of phase 1B when we went into that, and that would have taken us quite a while to get through.
What about those with disabilities?
So if their disability would have qualified them for the 1C, they'll be eligible when they're in their age bracket. Otherwise, they would have been with the general population under the previous phase. So this will actually move the majority of those individuals up.
Some are requesting, and other groups who are going to be talking tomorrow will request that those with disabilities be moved up immediately to the current group. Is there any word on if that's being discussed? Some states are doing it. Some counties maybe have the power to do it. Maybe you can even talk about how counties have been given a little bit more leeway to make these types of decisions.
So counties are really responsible for prioritizing those vulnerable communities and those frontline essential workers. So they will still be working on community-based pods and community strategies for vaccinating some of those high-risk individuals. And so they will be reaching out. I know Maricopa County has been working very closely with Access on strategies for homebound individuals, and so they are continuing to make those types of plans.
Do you suggest those individuals? For one person I spoke to, she's an 18-year-old. She hasn't been able to leave her house. She's disabled. She's fully taken care of by her parents. She hasn't been able to go to school either. Obviously, they want this not to be a lost year of education for her. What do you suggest for those who are in those lower age groups who have disabilities and chronic medical conditions? And you're saying 3 to 4 weeks out. However, for them, that's another eternity of hoping they don't die from this virus.
Without knowing the specific medical conditions and history, I would say this likely will move through the age categories much quicker, and so we will be able to get them. We anticipate being through the age categories by summer.
Can you talk to us about the Johnson & Johnson vaccine? Has it arrived? Where is it? What counties have received it?
Yeah, so the Johnson & Johnson or the Janssen vaccine will arrive starting early next week, and it will go to all 15 counties.
Okay, and those will be distributed to smaller health clinics, pharmacies, all sorts of different locations?
Yeah, so the counties can utilize that vaccine how they want to prioritize it. It's a game changer because it's one dose and it's just as effective at reducing hospitalization and death as the other ones that are 2 doses. So we're very excited about having this. One of the strategies that we recommend is for those frontline essential workers, because they're younger, they're healthier. We want to make sure that we are protecting them as they have day-to-day interactions with the public, and so 1 dose would be able to get us there faster with those populations. But the counties really are able to develop the strategies for how they're going to utilize the vaccine in their communities.
And that brings me to a question that we had from our partners down in Tucson. Some doctors were suggesting maybe some of the Pfizer and Moderna can be turned into a 1-dose vaccine based on what we're seeing in the data. Have there been any discussions on this, and is there any plan to consider such a thing?
So we continue to monitor the data. Currently, the emergency use authorization from the FDA does require both doses, so we're continuing with the 2-dose recommendation at this time.
Hi, Dr. Chris. This is Daniela Zavala from Univision. And under this new model, it seems that the counties has the decision in terms of essential workers. And essential workers were, very excited that they were supposed to be next. And suddenly with this change, they feel they're up in the air. And my question is that there is eventually a plan for the state to vaccinate those essential workers. And the question is, because the counties say that they will work with employers. So many essential workers for, the small auto shop, the small, grocery shop owned by families, they are like, well, maybe the county are going to work with those big employers, Fry's, Walmart. How about us? So that's the question for you. That's the first question, then I have another.
Yeah, so that is a fantastic question, and I know Maricopa County is already thinking that. So working with, like entities like Local First and the Chamber to really hit those small businesses as well, because we understand not every essential worker is going to be the employee of a large chain. As we work with the large chains, what we may ask them to do is to incorporate local businesses in those areas, or ones that may be more decentralized. But then they were also, throwing around ideas like Small Business Saturday, where we try to open up appointments in locally based community vaccination sites where they can come and get vaccinated. But we are very well aware that there are small businesses that won't be associated with those large businesses.
Is eventually there is any plan for the state that eventually those essential workers will be able to vaccinate in State Farm or here, or that's still maybe on the long run? How do you look at it?
So we are focusing primarily the age categories at the state-run sites, the large pods, just because of the efficiency and able to do that. Essential workers, if they are age eligible, do not need to wait for their business to hold it. They can, if they're age eligible, they're always welcome to get an appointment at one of the sites and the pharmacies as well. And so what we would encourage them, we do anticipate, I think we've got a tentative estimation for, at the beginning of March, we moved into age 55 and above. At the beginning of April, we believe we'll be at 45 and above. At the end of April, beginning of May, 35 above, and then we'll open it up to everybody 4 to 5 weeks after that. So we anticipate being through all the ages that are eligible for a vaccine by the start of summer.
And the last question, and this is a follow-up from last Friday from one of my coworkers, and it's about Yuma. In Yuma, when one of our reporters talked to the mayor, he said that they have received 200 vaccines, and I heard that there are some plans to open a state-run site. If you can tell us a little bit more about the plans for those other two state-run vaccination sites, where are they going to be open and where?
So we are currently scoping out potential sites in the Yuma and Coconino areas. So I don't have a lot of details on those right now, but we are looking to get more sites in those areas and continue to expand as well, because we know that it's still going to be quite a while before we get everybody vaccinated. What we would recommend, make sure that that if there are local governments that are wanting to distribute vaccine, make sure that you work very closely with your county health departments on the strategy to get your employees vaccinated.
Thank you.
You're welcome.
Hello, this is Griselda with KTAR. Can you walk me through the decision to change the chart for priority lists for vaccinations? I'm seeing that it now focuses a lot on just on age groups and doesn't really mention when exactly are essential workers going to be able to get vaccinated. Can you walk us through that decision?
Yeah, so those frontline essential workers, so grocery store workers, convenience store workers, there's a list, the CDC ACIP recommended frontline essential workers will be eligible starting now, because the counties will be working with employers, they'll be working with communities to set up vaccination opportunities for those essential workers. The reason we moved to the age category for some of our larger sites and statewide is because as you look at the data, you see that age plays a huge role in the risk and adverse outcomes for COVID-19. So when we looked at 55 and above, that's responsible for 65% of our hospitalizations and 90% of all deaths in Arizona. We also had our team look at the prevalence of the high-risk medical conditions. When we move down to 55 years and above, we are covering approximately 60% of all Arizonans that have a medical condition. When we move down to 45 and above, we're hitting about 70 to 80% of every Arizonan that has a medical condition when we include those age groups. So it made sense to quickly move through those age categories because we are going to be able to hit a lot of high-risk individuals a lot sooner.
Okay, so at the county level, is it safe to say that they essential workers can begin to get vaccinated at the county level? Because I thought it was really up to the counties to decide that.
So it is up to the counties to decide that. They are able to use their vaccine for that. I know some of them are looking at working specifically with employers to provide employer-based vaccination sites. Some counties actually are already vaccinating essential workers, and some have moved into the general population. So again, it's going to be a county by county basis, but we are working very, very closely with Maricopa County.
Okay, and then also, can you talk about how this works for the pharmacies? Are they, following what the age group priority list that your department released?
So what we do with those that are participating in the CDC Federal Pharmacy Retail Program, so we fill out what the criteria for Arizona on a statewide basis are. So yes, when we've notified them of that. I don't know when how many days between notification and them, but it will go down to 55. And it does include some of those essential positions like teachers, law enforcement, and those types of things. And that program is getting more and more vaccine every week. And you can find the registration sites for Walgreens and Fry's at azhealth.gov/findvaccine.
All right, thank you.
You're welcome.
Hey, Dr. Chris.
Hey, how are you?
I swear I don't follow you everywhere, but
No, it's all good.
Josh Sanders with KPNX 12 News. Hey, President Biden said yesterday by the end of May, we should have enough vaccine to vaccinate every adult. Is that realistic here in Arizona as well? Do you think that, I know you're talking about this scaled approach and the hybrid approach, but 3 months from now, could we have enough vaccine for 18 and older, every single Arizonan?
I believe that they have set the manufacturing up to get that much vaccine out. And we have so much capacity now here in Arizona. None of our state sites are actually operating at the capacity, and we know that a lot of the community-based sites, if they had more vaccine, could provide more. So as long as we get the vaccine supply, we believe that through May, if it started coming in May, we could have Arizonans vaccinated by this summer.
Do you think there could be more thought to the essential workers? Because my colleagues here, we've heard a lot of feedback from them. Right now, it's just, based on this kind of age scale. And you said, by April, 45 and up, by May, 35 and up. Those essential workers that may be 51 years old right now, but are on the front lines right now, interacting with the public, whether they're a grocery store worker or whatever they may be, what would be your message to them if they said, hey, look, I put my life on the line every single day, and I thought that I was going to I was going to be in that 1C, and now it's kind of thrown a wrench into it. So is there discussion maybe that, I know this is fluid, that, there's a possibility of changing that maybe, in the coming weeks?
So that's exactly why we went with that hybrid model, is because we knew that we wanted to move to the age base to really protect those that were vulnerable from adverse outcomes. But we also were aware, that there could be a 30-year-old grocery worker that has to go to work every day. And we wanted to make sure that they were protected as well. So they are eligible now under this hybrid model through the counties to become vaccinated. And so this will actually move them up likely a little bit sooner, because what was happening was this will be a more defined list of essential workers, but it'll move them up quicker. Otherwise, the list of essential workers was very, very long and would have pushed all of those with chronic medical conditions back much later.
So right now, today, there's going to be a difference between state-run sites like this location and then counties and what they're doing with partners. So right now, potentially, if a county, say Maricopa County, decided, hey, listen, we have vaccine and we can vaccinate that 30-year-old essential worker at one of the partners today, that 30-year-old can get a vaccine today.
Yes, they would be able to get a vaccine today. Operationalizing it from the day we made the announcement on Monday may just take a little bit, but technically under the hybrid, yes, they are eligible if they are one of those frontline essential workers.
And if the county deems it.
Yes, and if
Okay.
the county deems it, yeah.
Thank you.
You're welcome. Hey, Cameron.
Last question. I've heard from a lot of people who got their shots here at Chandler-Gilbert Community College pod before it became a state-run pod. How are you guaranteeing that they get those second dose appointments?
So we try to honor second dose appointments for those that have already received it. I don't know that we've worked out the logistics, but that is something that we have talked about to make sure that we do have those second doses available.
Are they expecting to hear from you guys through email? Should they, because I've heard from folks who didn't get a second dose on site, so they were waiting for emails. They haven't received them yet.
Let me get back to you on that, Cameron,
Sure.
because I don't have the answer for you, but
Okay.
but that is something definitely that we are actively aware of and want to make sure we get them their second doses.
Perfect.
Hey, Griselda.
One more question. So Texas is fully reopening businesses. What about here in Arizona? When can we see that?
So we are constantly reviewing the data. Our data is heading in the right direction, and we are starting to look at, if we were to lift mitigation strategies, what would that look like? I don't have a great answer for you today, but it is something that we're currently reviewing.
Okay, so the state still is following that model of, if X percent of businesses can reopen, or they're able to reopen at a certain percent if the metrics are there. Is that still the model?
So we're still operating with a reduced capacity, and the mitigation strategies, likely what we would see if I had to predict and look in my crystal ball. So don't hold me to it because the crystal ball is sometimes wrong. But looking at potentially lifting some of those occupation limitations, but keeping some of the mitigation strategies in place, the physical distancing, the disinfecting, the mask use when you're out and about and around people that you don't live with, is one of the ways that we have discussed potentially lifting those mitigation strategies. All right.
Okay, thank you, Dr. Christ. Well, thanks again for being here. If you have a truck inside the perimeter, I will talk to you about how to get out of here. So, but do note that our participants who are Dr. Christ are available for one-on-one interviews. We do need to clear the site around 11 o'clock so we can start up. Thank you.